Good morning, everybody. Welcome to the Dental Diaries podcast. I'm so excited to have another Dr. Jessica here today with me. Good morning.
Morning.
How are you?
I'm good.
Yeah, good. Good.
Awesome. Yeah, no, it's good. It's a nice Saturday. Actually, Toronto's really nice today too, so it's good.
Awesome. I know another Canadian. This is amazing how many of you amazing women live in Canada. Yeah, it's an amazing day here in Chicago too. Very sunny, on the cool side, but we'll take it, right?
Yeah.
Sun,
Oh my goodness, yeah.
sun over rain any day. So Dr. Jessica Metcalfe is, oh my gosh, again, so much to talk about. So let's just dive in to your bio. Dr. Jessica Metcalfe is a full-time staff dentist, education director, special projects manager, and clinical investigator at Princess Margaret Cancer Center in the Department of Dental Oncology and Maxillofacial Prosthetics. Amazing. She's an international lecturer on the topics of treating the cancer patient. She has a special interest in head and neck cancer patients. She is also a part-time instructor at the University of Toronto Dental School. Dr. Metcalfe has always been ambitious and driven. I love this. And yet there was always this distressing feeling that she felt like a fraud or a fear of being found out. So interesting. When she learned that these are common thoughts associated with the impostor phenomenon, Dr. Metcalfe has since pursued understanding the impostor phenomenon, who it affects, and the strategies for self-management resources. Dr. Metcalfe's passion is to work with dentists to overcome these thoughts so they too can recognize their capabilities and accomplishments. Amazing stuff. And so incredibly unique. Yeah, I mean, let's start before we like come up and through, because I know you just launched a new website and this awesome webinar and all that good stuff. But can we go back to maybe dental school? So you went to dental school in Boston, which is where I went to Tufts. You went to BU, right?
Yeah.
Awesome city to go to school in.
Yes.
Loved Boston.
Right? Honestly, I miss Boston so much. The fact that you could walk everywhere, everything's super easily accessible.
Yes.
Food was so good. Actually, did you ever go to Stella Restaurant on Washington Street?
I don't know. It's been so long. It's crazy. I've been in Chicago for 14 years, but I still go back all the time and I do love Boston.
So I just got an Instagram post saying, like, all those, just with how the economy and everything's going, one of those staple, like, Boston are closing. And I'm like, it just eats at you, where I'm like, oh my goodness, like it was 4 years of so much learning and scariness, and from didactic to clinic, but there were parts of Boston that made it so much home.
Oh my God, I agree so much. Where did you live in Boston?
At Washington and East Concord, so South End.
All right,
not Southie.
Yeah, of course. Well, I went to dental hygiene school at Northeastern, like at Forsyth.
Hey, yeah.
I was down kind of in that hood, like down, like on the south kind of. But when I went to Tufts, I lived in Beacon Hill in the north end, because of course I was like north, a little bit more north. Of course, we know Boston, like walking city is so small. We say south and north. It's like, I could walk to the south.
It's so true.
It's such a beautiful walking city. And we make an effort to go back there every year. So my husband, whom I met here in Chicago, is from England, but we met here, but he proposed to me in the gardens in Boston. So we would take, because it was from there, like an annual picture by the ducks, the ducks, like, and had proposed. So like every year, and of course when you're married and you're dreaming about your future family, I was like, someday, like, we'll get the picture of our little ducks, our kids in this spot too. And but every single year comes around and we're like, kids at home, like, let's go just have an alone weekend where we can just walk the city, go to a matinee movie, go to the North End and have dinner. I mean, it is a special place. The Union Oyster House. I mean, come on.
I just was there the last time in January when I went to go to Yankee Dental Conference. I lectured, and then one of those was we have to go to, we have to go get oysters. This is what needs to happen.
Oysters ever. And the experience there when you're in the new oyster house, how old it is, and the history when you even eat upstairs. I mean, it's just something everyone has to experience, but I loved it. I loved it, still love it so much. Yeah. But, you know, for me too, having been, it was like hygiene school and then dental school and then residency. Like I was in Boston for so long that it started to kind of close in on me.
Yeah.
I think more so, to be completely honest, it was like the dating scene. So I had been to the Green Tavern and like I'd been to all the bars. Like I had met all the boys, like all the, you know, like if I'm ever gonna meet my husband, I don't know, like
that's awesome.
It's a small city. Like
it is, yes. It is.
This time, I don't know. I came to Chicago on a whim on a weekend and I fell in love with it. It felt so big and broad and just, you know, there was so much here. And now when I come back to Chicago, it feels like home ever since I got here. Like I love it here as much too. But I get back to Boston often.
Yeah. Oh, it's good. It's a good city.
So you were there. So was it in dental school then? Like that you
So it actually started before that. In the middle of undergraduate, so in the middle of my program, I did a honor specialization in biology and a minor in medical sciences. And I noticed I was having a lot of difficulty with keeping up with all the readings, because being in biology and being in science, it's so much information to try to keep up with. And that's when I was diagnosed with a learning disability in reading comprehension. And I had to learn how to learn all over again.
What?
And when I went to dental school, I was like, I prepared myself enough that I was ready, but anytime there was a different transition or every time there was something to try that was new or a new challenge, that's when imposter phenomenon kind of catches in with you. And so I noticed even up until a few years ago, when someone would say to me, "Oh my goodness, you're so smart," I would discount it in such a way that I would say, "Oh no, I work really hard." And it's that mind shift. It's no, I am smart. I put in a lot of effort into where I've gotten today, right? So we change that script in our head, and that's what I ended up doing. So it wasn't until a few years ago where I started to piece more things together and was recognizing that I'm creating this own negative mindset for myself, so that when I do approach new challenges, or when I do approach new lectures, or even treating patients with difficult treatment plans, you not necessarily second guess yourself, but you question yourself, and there's a negative self-talk instead of a positive self-talk. So it was a few years ago that's when I started to, all the puzzle pieces came together, and I told myself, I was like, I can't keep doing this. This can't, especially if you want to last in dentistry an extended period of time, you need to create an environment for yourself. Because isn't it right where you have one patient who says something negative or questions something in such a way that you're like, oh my goodness, this is really bad. But then you've got 20 other patients that said something so positive, but you can't recognize them.
Listen to this. So, oh, hell yes.
Right?
Get this, right? So during this time, this is funny. I have a friend that I was telling him, I was like, okay, listen, you've got to hop on Voxer. So there's this app called Voxer, and we've been talking, but like text and everything. And I have just found with time, I don't have time really. I'm always racing. So this Voxer app is like walkie-talkie, and you can, talk while you walk, whatever. Anyway, he has been, to me, like so passionate about dentistry. And I look at him and I'm like, God, I wish I felt like that. Being multi-passionate, the negativity nips at me, right? Like, and it just makes me want to like run to my little colorful place, and the other kind of fun stuff I do. Well, so we were talking on Vox, and anyway, so I said, well, you know what? You're just lucky. Like I've been living at Soiree and doing all this stuff that's feeding my soul, and it's so positive and like happy, and not gonna lie, like there's anxiety about going back because of that shift. and that little bit of negative and like all of it coming back, because it is, to your point, that one person. So he gets on and Voxer, and I like look down and it says like, it's a 10-minute rant, like on the walkie. He's like, let me tell you something. I do not love dentistry. I don't, because you know what I don't like? And he goes on and on. He's like, it's that one patient. It's that one patient, every 12th patient that says, you know what, doc, this chipped and this shouldn't have chipped, you know, and whatever. He's like, I have patients that have had veneers for 20 years, but it's that one that something happens and I don't know why, you know, and he's going on. And I was like laughing and almost crying because I was like, gosh, this is our story. We don't take the 12, we take that one, and that one just at our soul. And we did everything we could. We did the same thing we did for everybody, like to perfection. And we don't have a rhyme or reason, but like, that's what, just continues to keep us up at night. And so it felt good. So as a female, I would think that this would affect us a little bit more, because you would think with men, right, it could just kind of roll off. But it was just really refreshing to hear that, you know, it got him too. Yeah. And, you know, it was good. It was good. And I needed that. I needed to kind of hear that. So it is, I think, amongst all of us, you know, we always come back to that negative. It's lonely, number one. And then like you put that little bit of negative twist into it. And it just makes it that much more difficult, because it's difficult sometimes to change your mindset. I don't know if you heard the podcast with Dr. Laura. She's a coach for women, but she was saying too about driving to work and changing her mindset, like in the car before she literally gets out.
Right. Yes, I did. Yes.
Yeah. And trying to do that. So, I mean, is that something, so when you're talking about like the negative and mindset and flipping that switch.
So it tends to happen when we have that transition or have a new challenge. So when we're faced with that new challenge, the cycle starts where we stress and we have this uncomfortable feeling, or butterflies, let's say butterflies in the stomach sort of thing. And it leads to an anxiety aspect of it. So we associate that new challenge with that anxiety. And we create this negative feedback. So when we go question ourselves, we then overwork or avoid. And the overwork is the drive for perfection, or the avoid is then we leave it till the last minute. It's because of luck. And then we end up succeeding because the imposter phenomenon is high achieving and high functioning individuals. So we end up achieving, we end up succeeding in any task or challenge that we take on. The problem is then we discount that success. And then when we go back into a new challenge, that anxiety is automatically linked to that negative, I don't know, and I can't do this. Meanwhile, we just proved to ourselves we could. It's just, we didn't relish in the fact that we were just successful. And so for me, my biggest thing is I keep kicking that goalpost. So I never end up getting to the goalpost, enjoying it, but I've already set 2, 3, 4 more goals and I'm already looking to the next.
Oh yeah, always.
Right?
Always.
So trying to watch what those questions are. And so now I know I associate that anxiety with also a form of excitement. So like, just like today, I got super nervous coming on for the podcast because I was like, oh my God, am I going to be able to answer these questions? Am I going to be able to, but a part of me is still like, no, I really enjoy this. Like I've prepared. I'm now like, I have all this knowledge behind me. But I know that I get still nervous, and I chalk it up to the fact that I want to give it my all.
Right.
I want to, right?
Yes. So like, what if you forget something that you wanted, you know, to say, like, or whatever. Yeah. No, I hear you 100%. It's fascinating. It really is, because do you think that, I mean, obviously this is, I don't know, I think this is probably more broadly universal, but definitely with dentists, right? Like
definitely with dentists, definitely with medicine. Some research papers have come out in regards to pharmacy, nursing, dentistry, and medicine, and linking the imposter phenomenon feelings to affecting your psychological well-being and ultimately burnout.
Yeah.
And that's where, especially you said it too, when that one patient to 12 and that perfection that we drive for. And when we do that, because of the overworking aspect of it, we think that the next time then we're not going to be able to live up to what we were just able to perfect.
Yeah, it's crazy because I love that in the feedback loop. I'm glad you're saying this is all chemistry because, of course, like this happens to me too. When we were in New Orleans before the storm like broke out, because we came back from New Orleans, I took my team down there for CE. We came back and like never went back. I was speaking down there, and this is crazy too, because, and I read this, so we've got to get into the whole speaking thing because I can't believe like you said nervous. I am a high I personality. I love to talk. I love people, but like you tell me I have to speak and I go blanco, like my heart, like I just, until I step in, and then all of a sudden, like, I don't know what I'm going to say. And I'm like, I'm going to mess up and I don't remember anything. And then, 2 sentences and suddenly I'm flying and in my element and I love it. But I had this thing happen where all of a sudden my entire team was with me and my husband. I guess they all knew it. I didn't. And someone said something about a review and I kind of heard. I said, wait a minute, what? Someone just say what? Like about a review. And Andrew's like, who just said that? She wasn't supposed to know. So there was a patient, and we have these patients that are like, whoa, a little off the rocker. I had a patient that had moved. Long story short, my practice is absolutely known for customer service and like responding and getting back to them. This patient had moved to Colorado and had been trying to get in touch with me. I had a new team member at the front and she knew that, but she was trying to triage it herself without coming to me. So the patient's needs didn't feel met. And she went on and wrote a review, not just on Yelp, but on Google, on my personal, and then went to my other business, White Hot, and wrote like, you never want to see her. She's like paragraphs. And I went like, I cannot explain my emotional state of before. And this is like probably 2 hours before I was supposed to go on stage. And I couldn't breathe. Like I couldn't breathe and I couldn't think about the stage or any of that. Like I kept telling myself, Jessica, later, it doesn't matter, just, it's okay. Like, it's just, how she is and that's okay. You'll handle it later. But I was so concerned that in that 2-hour window, other people were going to see those reviews, those untruths, and judge me for it, that I couldn't see past it, so like I ran out, I was like, I need to handle this right now. And like ran out to the back. I'm like, I'm calling the patient right now. And had left a message and then, and didn't get through to her and didn't even know she'd ever call me back. Right. So I didn't know, but I said, this has to be handled, directly, and had left that message that, absolutely there's been a misunderstanding. And I just want to let you know, like, I am absolutely here to hear you and all of that. And, she was threatening me, like, if I didn't fix it and like find her a doctor or whatever, she had just chipped a little from a veneer from years ago. She had chipped a little edge and I'm really upset. But my team and everyone was like, don't think about it. Just out of mind, out of sight. Like, turn your phone off. Because I was waiting for her doctor to call me back. Because I also texted that doctor. I was like, please call me. Can we handle this? Because I wanted the reviews taken down. I have all 5-star reviews. It was like the first one everywhere, which I couldn't change my mindset to know, listen, if somebody goes there, they're going to see 20,000 5s, just one. Don't they say that just that one is actually good? So people see you're actually.
Yeah, the balance. Yeah.
But I could not get past it, So fortunately I did turn off my phone and said, listen, I'll talk to the doctor later. I'll deal with it all later. I've got this in front of me. I've got dentists I need to like inspire and empower, like step into your element and get rid of that, that negative. But I just think, with all of us, like this kind of stuff, we're all in the same, I don't know what this kind of stuff happens where we let it kind of take over as, even though, I'm one of the most positive spirited people, like too, like I get it and I know how to do it and move past it and I know everything will be okay. And then it is, but in the moment.
And that, you can't. So in the actual moment, it's almost as if it's the snowball effect.
Yeah.
right? Where
Avalanche.
yeah, exactly. So it starts as that snowball, it starts to roll, and it turns into that avalanche, right?
Yep.
And in order to break that cycle, instead of just jumping to that positive or think things better, or because you're not going to feel it, you can try to think it, but you're also not going to believe it,
Yeah.
right? So it's then trying to come up with those neutral thoughts, right? So there's this psychological thought exercise. It's called the thought ladder. You can call it stairs, you can call it whatever realistically. And it's, you're starting on the bottom and it's your initial thought. So in your case, it would have been that someone's going to review it, they're not going to come to me ever again, right? Versus where your goal thought is. And so your goal thought would be, yeah. Did you have a question there?
No, yeah, you saw my face. You guys all can. My face just kind of, you know why? Because, well, gosh, we're getting psychological here. It wasn't necessarily, now that I'm thinking about it, what other people thought. It's the fact that I knew personally, the perfectionism in me knew that I had done everything, right? The way it should have been done. You know, I dotted my I's, crossed my T's, given her my heart and my soul of everything I have. So it was my personal, what do you call it? Like, she took away from me, like it was a dig at me, I think personally, where I wanted to fix it. Right. Because I was like, I'm not that person that you are like just throwing all that yucky stuff up on.
Right. Right.
You know?
And it's so interesting. If we look at both sides of it, the perfectionism and that imposter feeling comes out when it comes to your side, right? And then her thought process is completely irrelevant to what you were actually thinking and feeling.
Well, it's threatening.
Right? Right?
Yeah.
So her thought process was completely different in the fact that you weren't able to fix it immediately or yesterday.
Right. Well, I mean, I think she wanted to cause fight or flight to make me answer, and it worked. Right. You know, which isn't a good thing.
What was her thing though? Like, what did she want with the?
This is the thing in dentistry, and you guys all know it. We all know it. Like, if a patient, this is why it's so, I feel like a little bit negative. And this is what I was talking to, my friend on the Vox about too, because if somebody, it can be 6 years later, and if they chip a little edge and they could be like opening a bottle, they're like, you should pay for it. You should have lasted forever. And, and I'm like, what the hell? Are you kidding? Are you kidding? Take some responsibility.
Right.
And it's really hard because, financially, I mean, dental practicing, the overhead, I know you're in hospitals and whatnot, but like the overhead is so high as it is, and the lab fees and all of that stuff that, we would help everyone. And that's the thing they don't get, is that we would give it away for free. All of us. And I give so much of it away for free. But, there's got to be like some fairness and not this like, kind of negative. So she wanted me to pay for that doctor to fix her veneer. And then wouldn't even look to take any reviews down until she knew that I would take care of the fee, the expense of it.
Wow.
And, and you're in a predicament where then you get angry because I'm like, no way.
Get defensive. You get defensive.
You go through all those, the emotions, because I was like, that's not right. And it doesn't feel right. And it doesn't feel good. But yet, like I said, you put me in the corner and I'm going to have to take care of it. And what is it at the end of the day, as people say, and even on that call, when I was talking to him too, he launched into a story about someone too that had veneers, and then like however many years later, like something happened, and then she went to an attorney and he's like, I had to give 10K back. And it's like, after all the lab fees, after all that time, and it's years. I mean, this happens to all of us when we did a really great job. So we do this amazing job, and then you have someone, because of something, that they did, because if it was something we did, we're such perfectionists, we would take care of it. We would,
of course,
own it. We would own it and do it. We felt good.
So true.
For the patient. So I think that's why, like, this cycle or this cyclic thing is so difficult. But but I love that you're working with people for it, because what's happening, like, you know, we keep going back to it, but like COVID, especially, like people that,
Yeah.
that were already there, that like felt like they couldn't get out, unfortunately, you
Mm-hmm.
know, and not be able to change that mindset. But having to
Yeah.
change that mindset all of the time in dentistry is exhausting.
It's exhausting. Yeah. It's completely exhausting, because let's say you have 8 difficult cases in the day, you end up doing it 8 different times that day. So when you get home, I also find too, the last thing I want to do is converse with people. And sometimes I end up being like a lump on a log, or bump on a log, because of the fact that you're just so exhausted and you gave your all during the day.
Right. Because
Right.
mental and physical. I say that to
Yeah.
yeah, I was just saying that to my husband, because when I get back as well, like next week, I've stepped into a real happy place for me.
Yeah.
And I feel like it's my calling more than anything. Like I truly feel like, you know, like people will say, you know, okay, but this is the golden egg, like your practice, and like, why, you know, you do this, right? And I'm just like, God, I don't know. Like I said, it's
It
definitely
may be so there's nothing wrong with thinking that, and that it may be the golden egg for someone, but it's definitely not, if it's not for you, there's nothing wrong with that either.
well, it's never been about money for me. None of this ever has
Yeah.
been about that. It's been about like my passion and where I'm at in life at that time. And I still love dentistry. My gosh, you get in there, the people, like I adore it,
Yeah.
but I'm multi-passionate. I have other things.
Yeah.
And because I've been living in this space, what I said to my husband is like, oh my gosh, so next week, you know, I go back. And to your point, the exhaustion, when I have to step back into dentistry,
Yeah.
and we haven't been doing it for a while, and all this PPE, which we're not gonna be able to breathe, like, and that's not who I am anyway, right? To talk about
Mm-hmm.
imposter syndrome, like I'm someone that wears cute dresses and sits down and like
Right.
minimalist, right? Now I've got to be all garbed up and sweating with all this gear. I'll be hidden under there, but like that's not my personality. It's just it's
Right.
not gonna feel great. But I said to him too, like I'm so concerned because I have some big cases to deliver, like full upper arch. I said, how the hell am I supposed to handle these little, you know, through a shield that's going to be bumping them, and then like all of this
Yeah.
equipment with a little teeth that I have to cement on to, you know, 12 of them all in an upper arch without gluing them together very quickly in a dry field, upside down in a dark space with saliva. Like I can't, right? I'm already stressed out. But what this
I'm
looks like,
starting to sweat.
yes, I said, Andrew, I don't care if COVID gets me. I mean, I was just thinking, it needs to be right for the patient. And if
I
that
know.
shield isn't working for me to get it right, it's coming off. Like I'll have
Right.
on goggles or whatever, you know, I wear, but but again, to your point, the exhaustion, I'm afraid, like I said, I'm like, where is my creative time going to be? Like, how can I build that back in? Cause I'll go home too and I have 3 kids. It's like,
Yeah.
there is a lot. So just trying to figure out, right, how to kind of spread it out. But like you said, we're all going back to riding the bike right now. I mean, we've all been off it for a while and we're all going to be a little like, whoa,
There's
it's
a
not
transition.
scary, but it's
It's
the rhythm of life.
And that's exactly it. And then it's the fear of what you said it perfectly. It's the fear of not knowing, right?
Mm-hmm.
And we continue to think we won't be able to live in that, right?
Yeah.
Or we won't be successful, or if we show up, there's going to be many mistakes.
For me, I'm like the little girl. I'm like, I don't want to. I won't. I swear to God, like this little stubborn thing. My husband every day is like gently like, Jess.
Right.
Okay, so I ordered the, you know, the hairnet thing or whatever. And I'm like, yeah, great. You know, or the sneeze guard. I'm like, you know what? Do what you need to. Do what you need to. Just get the stuff, get the goods.
Yeah.
I'll be
But
there.
here's the thing, as much as you're stressing about it right now, you know when the time actually comes,
yeah,
you'll be fine.
I know.
You'll still be sweating, and it's that lead up where you have to change then that negative self-talk. So then even if it doesn't become that positive, because right now, you said it exactly, we're essentially practicing in spacesuits,
Yeah.
right?
Yeah, I've never worn scrubs except in on mission trips. Like,
Right.
and
So
I've covered those, and yeah.
Yeah. And so changing that dynamic, it's just, let's go back even 50, 60, 70 years when people practiced wet dentistry, right? And then all of a sudden, other diseases became known. And so people were forced to wear gloves, right? Now, I can't imagine doing dentistry without gloves.
Of course. Oh my God.
Right? But so that's where we have to, so at that point in time, they were totally against wanting to have to wear gloves because that's the way that they had originally practiced.
Yes.
Right? Was without gloves.
Yep.
Now we've seen, even with the changes of, okay, your goggles instead of just the mask, okay? Or mask and goggles. And now we have this addition until we know more information about what's going on, right?
Forever. Like it's not going to be, the N95s like aren't going to be forever because they are hard to breathe with. I mean, for sure.
Right.
Like, and
especially for those long extended procedures, right? Like those are definitely, but it's at the end of the day, you know that when you are presented with that, you're going to figure it out. So that stress that comes from the lead up puts you in such a negative. So then when you do try another challenge in whatever aspect of it, that's when you have that anxiety and question yourself repeatedly, but with negative questions. Instead of saying, I've done this. This is how I've changed my practice prior. I've altered, I've upgraded, I have new sensors, we integrated software, right? And then this time, it's one more thing, and I know I'm going to be able to get through it. Yeah. And it's trying to change that negative feedback loop to create those neutral thoughts so then you can believe those neutral thoughts. Because if you go from all of a sudden negative Nancy to rainbows and sunshines and unicorns, there's that in between. You're not going to be able to jump all the way there. And that's when exhaustion kicks in even more, because you tried to fill this gap with actually taking those baby steps to get there.
Well, I think a lot of dentists, so the thing is though, that's hard there is dentists have to be leaders and they have to show up and be rainbows and unicorns, whether they're feeling it or not, to lead their teams to be positive and successful in that. So, you know, that's hard too. Talk about an imposter syndrome. You know, if like Laura was saying, she has to say that in the car to try to like, you know, prep herself for going in, which I think, you know, a lot of people do. I certainly have some days too, if I've been in kind of like just like a like place, you know, just switch the mindset. Let's go like on. And it is amazing because once you step in, you see your team, you're like, woo, let's do this.
Right.
You know?
An example. So I even have those self-talks even throughout the day. So not just necessarily at the beginning of the day. So like on my lunch break, or I know another dentist where they have this aspect or this acknowledgement with her assistant, so the dentist and the assistant, as the chair starts to lean back, they start to breathe together. So then they're taking that meditation breath aspect of it. So it's trying to find that dynamic that works for you and your team. And so I know for me, when it comes to, let's say, I do a lot of extractions. And so when it comes to a more complicated extraction, there are those times where I'm like, oh my goodness, am I going to be able to do this? Should I have referred this out? Maybe, right? And so you're looking at the radiograph. And so I'll take that couple of minutes before I go in, because I've treatment planned it already, right? This isn't a surprise. So I've treatment planned this already. Clearly I had confidence at that point in time, right? So I bring that forward. I look at the radiograph and I say, okay, what is it that I'm concerned about? So, and this is where I'm talking about not necessarily with your team, and like when you walk into that room, I completely agree. You definitely have to put on that face. But that lead up talking to yourself though, is so then you can believe it, right? So it's okay, well, I've chosen to do this extraction because I know I'm confident with it. I've done 150 of them already. This isn't my first time, right? Yeah. So it's those are the neutral thoughts that I'm talking about. It's stating the facts because we don't believe it. And that's what imposter phenomenon is.
Right. Well, we definitely, you know, you make the decision when you wake up what your day is going to be like.
Yes.
Which is amazing. So, you know, I've switched even over this time, because over this time, it was very easy, which I don't do well with. Again, back to perfectionist thing. I don't think we do that well with like all over the place, like waking up, like kind of whenever, which I'm always an early bird anyway, but like even the kids sleeping a little late, like everyone, I don't know, I just kind of feeling out of control. But I would watch or listen. So this even actually before COVID, driving to work, sometimes like one day I had to drive my husband's car. I think mine was, I don't know, getting something done. And I couldn't figure out on his electronic, like he has a newer version of the board thing. So I couldn't figure out how to get the radio on necessarily. And he had the, what is it called? Like, the auto sets, what is it called? Like, I don't know, on the radio, I don't know. I forget what it's called. Oh my God.
That's okay.
There's all of these, like, more TV, like he'd be more apt. So he's a golfer. So he'll listen to like ESPN, like they were talking stations.
Right. Okay.
And I'm even forgetting what his name is now. He's like a preacher guy. Olstein.
Okay.
So I am a universe person. We all have our thing. There is something definitely way bigger than us, and whether that's God for people or the universe or whatever it is. But I started just listening to him. There's something about him, but it was so positive, right? Like whatever he was talking about, it was so good. And I walked into my girls in the office and I was like, hallelujah! Like, let's go. And I told him, I said, I was just listening to Joel Osteen on the way here by total default that like spoke my love language, had me on like mission go about life, about like remembering the little things and stepping in and all of that. So you can either like, and so now like over this time I get on the treadmill and I listen to impact theory. I watch a YouTube episode with, whatever. And they're just so, all of this stuff we're talking about, but like that positive, and you literally, it totally changes your mindset where you're like, let's go kids. Yep. You decide. I hear myself talking to the kids differently. Right. And like, I'm so ready to step into my day and take my day on. Yeah. Versus, like, oh my gosh, like racing, the alarm's going off and you're racing to the shower and you feel, behind and you're not tasting your coffee even out the door and you don't even have time to process or think or be. Right. I think to wake up a little bit earlier, to give yourself grace and a little bit of time to make those decisions. Like they say people in life, especially entrepreneurs or highly successful people, like get up and they actually take a little bit of time, whether that's meditation, journaling, forecasting their day, but like giving themselves space to then, kind of follow that plan. They seem to do a lot better with it. Like I'm still working on that part. But.
So it's very interesting. So the 5 a.m. Club by Robin Sharma, he talks about that and how you're supposed to give yourself an hour before you start your day, and that's your alone time, and it's separated into three components. The first is 20 minutes of intense exercise to the point that you're sweating, so whatever that may be. And the reason for it is that your cortisol levels are increased in the morning. They're at their peak. And that's why when you wake up in the morning, you may feel more anxious, your mind's racing, right? So the exercise brings it down. You then meditate or journal for the next 20 minutes, and it then levels that cortisol out. You reflect that gratitude aspect of it. And then the next 20 minutes are you doing personal growth and development, not necessarily with dentistry, but you focusing on yourself, right? And that aspect of it gives you that hour. Now, and I had this discussion with a friend. She's like, Jessica, I'm a night owl. Like, this doesn't make sense. The 5 a.m. club wouldn't work for me. And I said, that's fine. It's bringing together that hour of the day that is most important to you and your mind is most tuned into that, because that's when you're going to change it, right? So
yeah, totally. I mean, that's the Miracle Morning too. Brilliant. I mean, he's incredible. That book. It's funny when someone says I'm a night owl, I go back and forth with my husband too, because I struggle here because I'm an early bird. I could get up at 3:30 and start working. I love the mornings, but I struggle. He's a night owl. So he'll, even in bed, sometimes he'll take the iPad in bed to watch Netflix. And I'm like, wow. Put
the light.
I know the light. He even puts it on the dim thing and I'm like putting pillows up. So like, I don't see it. And like, I'm frustrated. But then like in the morning, he kind of wants to like sleep in a little later, where this is completely not fair, but I'm like, can we just all like turn the music on and all get up and seize the day together, like seize the day.
Yeah.
It's harder to tiptoe around in the dark when you go back to work and like everyone's still sleeping. It's not exactly like you can turn it on, like you said, unless, you go find a space where you can or put earbuds in, turn that music on, you know, that mind shift.
Right.
Something interesting my husband's been doing, because I was just thinking about how you said like exercise, cold showers work for people, which I
Yeah.
don't know how. My husband started doing that with breathing technique though. And it's been insane
Right.
over this time. And I don't know who that person is, where he's done the breath, and literally he's like, no goosebumps, feels warm. And he's like, feel the shower right now and it's ice cold. Like I would never want to do it, and that's great.
Wow.
It's his thing. But like, that's what he's doing for his,
Yeah.
you know, we all find whatever works for us. Totally. But I wonder, I always think, I'm like, can't you go to bed a little earlier to start getting up earlier, like habits? But I
Right.
wonder if we're chemically programmed like that. Like some people just, that's when their soul is
Yes.
the most at night, you know,
Yep.
versus ours
It
in the
is.
morning.
And then you also need kind of that a little bit of alone time to re-energize your battery. So that might be, so the way that you re-energize them in the morning to give yourself that ready for the day, he does that at nighttime for the next day.
Yeah. Yeah. But then I don't know. Then I'm like, he gets up the next day, still loafing around. I'm like, come on, woo, energy. Let's pick it up a notch over here.
Right.
Especially if I've just gotten off the treadmill or a run. Like this morning, you know, I went down to the water, and it's just, that feeds my soul. It's so, the fresh air and all of that is so incredibly, incredibly good. Because mindset is everything. You've got to be in the same place. And I get, you know, it's like so frustrated too. The poor kids right now, it's like just living on devices. And I'm like, we should sit down and journal, like, I don't know, create, do vision boards, do something positive, like look outside of the screens at life, you know, for what it is. And because it's such a gift. And journaling is something I did for a very long time. I mean, I have journals from when I was 11. So I probably have 50 journals, which I love as like a legacy for like the kids, like leaving behind my story. And I keep meaning to step back into it. And Amy, it was on, one of my podcasts, she was talking about Janning. I don't know if you're familiar with that.
No, I haven't heard of that.
Journaling. It's one of Tony Robbins, a woman that I believe works with Tony Robbins, does this. But so you just like write like crazy, I think, for 15 minutes, like whatever is on your mind. The brain dump. But it's also then positively saying what you're going to accomplish for the day too. So it's like goal planning and journaling, like reflection, goal planning and journaling, and like, just brain dumping. And so it's supposed to be really great. And I was like, I think that's something I could do, you know, if I give myself that space and time. But my struggle is like in the morning, even getting up early enough for work, which of course I could change my schedule, right? Like I could go in and see patients at 9, and I tried to do that, but I want to be able to accommodate them for 8, which means me getting to work for 7 to do morning huddle, like at 7:30 before the patient. Our gym opens when the gyms reopen at 5. It doesn't give me enough time, even if I'm there at 5, to get like a lift in and, you know, and the cardio, because I trained for a competition in December. And so I got really into this aspect of like the gym. I never loved lifting or even knew anything about weightlifting. And now it's definitely become part of my life, and I miss it so much. But I just couldn't get it done. So I found myself anxious at the end. So I was like, now I've got to get off the step mill like halfway through to quickly run to get the shower. So as good as that was for my soul and like the exercise, I was like still having to break it and race because I didn't have enough time. And then I was like kind of frustrated. Like I wish I had a schedule where I didn't, you know, have to kind of race, or because then I felt like I had to finish it later. And I'm like, you know, later in the day, which you don't have time for. You need to find one pocket of time to do it in. But like I said, we're forever figuring out what works for us. And I mean, and the beauty in all of that is that we do make our own life schedules and, you know, decide what we want to do in our lives, and whether that's like even pivoting, like we were saying, you know, you have to truly love where you're at and what you're doing, because that's where you're going to be fed, you know, all of that.
Anything you need for your mind, body, and soul. That's what
right?
Yeah. That's so interesting, because I just read an article yesterday about creating a jet lag for yourself by adjusting your morning routine. And so the concept was that you gave yourself, this person in particular wants like their 15 minutes before the world wakes up at 5:45, and then their family gets up and everyone gets ready for school or whatever or whatnot. So they decided to change that morning routine to 5 a.m. instead. And that extra 45 minutes, because they thought, oh, the full hour is exactly what I need to do it. They found that A, it was too much time, and B, then they created a jet lag because of them. By the time the evening rolled around, they were so exhausted, didn't want to hang out with their family. So they established that, you know what, the 15 minutes was too short, the hour's way too much, but I actually only need 25 minutes. So then instead of just jumping and thinking this unsustainable effort that you're not going to be able to change, it's doing it in such increments. So, but then acknowledging those increments.
Yeah.
Right.
This is also crazy. This is like a whole feedback loop in itself, because I'm like, you're right.
Oh.
Guess what? I just discovered talking to myself. I was like, actually, it's your perfectionism, because you want to finish the whole lift, but you could have gone hard for 20 and gotten the same thing in and been fine. And like, you still accomplished something because you went. It's like, we know this stuff, right? We have the answers. It's so crazy. But back to your original point, and like why you started this is because we beat ourselves up, and it's not good.
No, not long term, because that increase in anxiety, we know what that flight and fight in an acute response. So stress is the natural response to a physical threat, and anxiety is a response to a non-physical threat. Well, the reason why back in the day, that fight and flight, let's think like caveman times, we had to run away from like tigers and lions and all of that stuff, right? So that's stress. But in today's day and age, that stress of linking where we're needing to run away, we're creating this negative. It's the same thing back in the day where you were more likely to remember a negative. So for instance, you're out scavenging for food, you're more likely to remember what not to eat because it's poisonous versus what actually tasted delicious.
Yeah.
Right. And so bringing that to today with that increase of an anxiety, when we're living in that chronic state, then that's where burnout happens. And unfortunately, with dentistry, if you're working full time and now going back into COVID and having to change that mentality, it's that we want to make sure we're in it together as well, and not just leading back to thinking that the first day that we go back, it's got to be perfect. It's not going to be perfect, right? There's going to be different adjustments, not just with me as the dentist, but with my staff and how they respond to then patients coming in. It's going to be a completely different environment for when the patient comes in and sits in the waiting room now. Right? To where they then come to the operatory. So taking those minor steps to change so we don't feel like an imposter. We're not frauds. We have our dental degrees. We've been practicing, right?
I know. It's just, it's humanity though. It's like,
of course.
I want to shake their hands. I want to be close to them. And so it is different. I think it's embracing the different.
It's embracing the different. And you said it, it's not going to be for forever. It's
yeah.
definitely not going to be for forever.
Exactly.
So it's changing that for right now. And I read something where the social distancing, where trying not to judge when you're out for a walk or when you're out chatting with someone else, and if someone takes a step back, right?
They stop like a strong stop as I'm running. Like someone will it's the weird.
But not to take it personally. Yeah.
No, totally agree. I know. And I know that, but for a minute you're like, not personal. You're just like, this isn't fun. Like this isn't.
I know.
No.
Because the human nature is connection.
It is. I mean, when I was running the other day, it's amazing because this entire time, nobody would even look up at you, like on the path, and then the mask. I'm like, this is so surreal. And like, why are we acknowledging and still give eye contact or smile the way we used to say good morning in the morning? Like, all of that kind of disappeared, but I think everyone's just been in this thing. And the other day, we had this like crazy storm, and it was just the lake kind of like came way up and whatever. But this guy, I had my earpods on, so I really couldn't hear, and it looked like he was talking to me. So I took one out, and he's like, look at the water right now. It's like the Mediterranean. And I was like, oh my gosh. And I was like, it does. It's so beautiful. It looked like little shells. And we started having this amazing conversation. Right. And I was like, and you know what it made me think of too, was like, I can't wait to get back to dentistry because of my people, because at the end of the day, it's like those relationships and the people that make my heart sing. And this was a gentleman I didn't even know, like, that just absolutely, like I said, I don't know, made my day talking, just randomly approaching, like, a stranger and talking, which was so nice. After all of this, just knowing like we can still be and interact and, you know, not feel, I don't know, just handcuffed by all this stuff.
Yeah. Well, the great thing about family medicine and family dentistry is that you are building those connections long term, right? So it's almost as if you're excited to go back to, not almost, but it is that we're excited to go back because we want updates from our patients too.
Yeah.
How have they been doing? How's everyone as, right? And then it's checking in with your colleagues on what's happening across the board, because we're in this together.
Well, I mean, there was so much. So I always choose positive. Always. There was so much, like, there were points during this time that I had to kind of step out of threads and all that because, right, dentists are already like living a hard, lonely, negative kind of life and world. And then why take this gift of all this time we just had? I still cannot believe how much time we had, and drown yourselves every single day in that stuff. We'll figure it out when we get there. Things are still changing, you know, so why? And like, even going back, I have a hard time. I'm not going to lie. Like seeing the posts, you know, and everyone in the PPP, like da-da-da-da and all this stuff. And like, I'm blowing up a ton of emoji smiley face balloons and putting a big bouquet, like, welcome back. We're back. You know, of course that's me. That's my personality. That's my brand. But like, you're not going to see me doing posts and like all of my stuff because like, that's the barrier to my patients. The thing is like, I'm still here. I'm still real. I miss you. I can't wait to see you. And it's going to be like the same thing. It's just, we're going to be wearing different things, but I don't know. I think it's scary to patients as it is, let alone saying, I know that people feel really strongly about saying, hey, we're taking all the precautions, but I really truly feel like they trust in us that we will do that anyway, because we did it to the utmost regard before, and we will be stepping in, which they will see the differences and changes when they get there and know that's supposed to happen because they've seen it in the grocery stores. They've seen it everywhere. It's the new norm.
Yeah.
We don't really need to bring it to light, you know, even more so, like, I think. So yeah, I mean, I'm embracing it with positivity and certainly have, like, on my feeds been like, you know, we absolutely can't wait. And what that has then, like you talk about a feedback loop, my patients have been literally sending me texts with like confetti emojis and yays and like so excited, and they're ready to come running back. Now the negative back when was like, okay, I'm fee for service. I collect 100% up front for everybody. Are people going to have cash flow to even come back? You know, that was the negative for a minute. But then the positive was, I said, wait a minute, when we went through the recession, that was my best year ever because my patients, I've set myself up for success that like my patients, that's part of it. They understand that. And I attract the people like want those things and are willing to pay for them and everything else, that value ladder, if you will.
Right.
So yeah, like that fed me back. Like the minute I kind of dipped
back. You got to catch that. You have to catch that. So that's the neuroplasticity that we can change those thoughts, right? So it's creating neural connections. And what is so fantastic is the negative feedback or the negative talk that we've keep creating ourselves. We've already walked that path. We're on that hiking trail, right? We've padded down that path. We can see it. Right? Versus when you try to change that new feedback loop and create that positive aspect, you're cutting through the jungle, right? You're cutting through the jungle. You're not going to see that path when you go over it again. You've got to keep stomping down the weeds and everything to create that path. But when you land on that negative and you're consistently, next thing you know, you've paved it instead of it just being hiking, right? Right. And so then it's that much harder to change that mindset, unfortunately. So.
Yeah. No, it's all like so crazy fascinating. I could talk to you for like all day about this stuff. Tell us, I know, because like it's already been an hour, isn't it? Can you tell us about so you did the Impostor Phenomenon, you water your own grass, like love.
Yeah.
Right? I say that with social media. I'm like, stay in your own lane, right? Like you take care of you. I actually don't have time to pay attention to other people. I want to support everybody, but
I know.
I'm like, I don't have time because I'm just like we said, cutting down my cutting my grass and watering it and trying to plant flowers that are in color. But so you taped a webinar that happened on May 12th, right?
Yes, this past
Is that
Tuesday. Yes,
recorded
May
and
12th.
up somewhere for people to still watch?
I believe it's just in the middle of being posted. So it's womensdentistry.com. It's Women in Dentistry Society, and they will have posted it. It's honestly, I am so proud of it and so excited that went down this past week. And I had great response. I had a couple of people who reached out to me afterwards, because my biggest thing is we keep looking over that fence. And if we stay on our side and we water it, we know will amount to anything we put our minds to. We know we're high achieving individuals.
Yes.
So
yes.
I
love that. So that's Women in Dentistry.
Yes. Yeah.
You said that just people have to just watch for that. It's coming soon.
Yes, exactly.
The replay will be there.
Yes.
And then you just launched your own website.
Mm-hmm.
And you do a bunch of things on that, which we didn't even get to. My gosh, all of the other stuff. I mean, you're phenomenal, but you do consulting for the cancer patient, because that is your world, and you're very well versed. Amazing for you that you do that. Do you want to just speak to that?
Sure. Yeah. So the consulting aspect of it is, if anyone has, so my main aspect of lecturing is treating the cancer patient. And I recognize we're taught in dental school about medically compromised, and maybe a bit on the cancer patient, but until you're actually given a cancer patient, whether it's breast, lung, prostate, and their pre-IV bisphosphonates, or their head and neck and their pre-radiation or surgery, trying to figure out if you're being aggressive enough or not enough, is always kind of that hesitant. And realizing that there's no crystal ball and hindsight's always 20/20, right? But I am there offering dentists that if they do have a patient that comes into clinic and they're just really that confused and they need someone to help with treatment planning, I'm there to help out with that as well.
That's incredible. So she's doing, just consulting, coaching, mentoring for diagnosis of the cancer patient, to help hold your hand, walk you through that. That's tremendous for dentists to know, because I would not know. I would want you with me for something like that, to make sure that patient was completely right. All I's dotted and T's crossed. Speaking, you do speaking engagements, talking about the cancer patient. Are you also?
Yes. So the most recent one that I lectured that I gave, or that I spoke about in January at Yankee Dental Conference, and then the Pacific Dental Conference in March in Vancouver, was about the head and neck cancer patient. It's not diagnosing. I'm not an oral pathologist. I'm a general dentist. And that's where I'm finding there's a bit of a disconnect. There's a lot of information on diagnosing, making sure you're doing your intraoral and extraoral exam, but there's a bit of or a lack of information on what to do when that patient then comes to you and says, my radiation oncologist says you need to clear me before I go for my radiation. Once they've then finished their radiation, there's risks and complications that come from getting head and neck radiation, and what to do with post-radiation caries, xerostomia, osteoradionecrosis, talking about how to continually treat that patient for continued care.
Mm-hmm.
So that's my topic. That's where my interest comes from.
Oh my God, that's amazing. Okay. And then, so there was the consulting, the speaking, and then you do, and then coaching. For the mindset, which is basically what we talked about. Yes. Time, the Impostor Phenomenon, and your new site is the Alchemist dentist, right? Oh,
it's drjessicametcalfe.com.
Oh yes, but then you have that so as the title.
Yes, my title is the Alchemist dentist. Yes,
yeah, Alchemist dentist, which is amazing. Because you had what was that quote on there? It said, "There is only one thing that makes a dream impossible to achieve: the fear of failure." Love that. That was amazing. So on that note, we will wrap up here. But if you, are interested, like I said, I'll make sure we have your, it's pretty much Dr. Jessica Metcalfe, like everywhere, right?
Everywhere. I kept it the same so that it's easy.
I love that. So you can find her on Instagram. She has her own website as well, where you can read a lot more about her, reach out to her if you need her for anything. So thank you so much for being here. This was a lot of fun.
Thank you so much for having me.
I loved it. Thank you so much. And until next time, guys. We'll see you.